Hey, Dr. Betchard here. I want to talk about scary plantar fasciitis stories. As you know, most cases of plantar fasciitis heal pretty readily with the therapies that we have here in the office. But once in a while, you get these strange cases of heel pain that don't respond to the usual care, and there might be some unusual injuries in this area. So a few of them are, number one, the plantar fascia tear. Plantar fascia is a ligament on the bottom of the foot that supports the arch, but with long-standing plantar fasciitis or sometimes with acute trauma, you can actually tear the plantar fasciitis. It's like a ligament, so it's like a sprain of the plantar fascia. Usually it's a partial tear, and a lot of times that will cause acute pain, which will limit the patient's ability to be able to fully walk with all their weight on the foot. So usually a period of non-weight bearing is required in a boot, and then we can get them back on track to healing. Very rarely is surgical repair needed, but on those occasions where there's a complete plantar fascia rupture, occasionally surgical repair would be indicated. Next injury is the stress fracture or cracked heel bone. The heel bone here is it can develop a stress injury to the bone. Usually starts where the plantar fascia attaches, but sometimes it can be due to repetitive trauma, and you could get vertical cracks that go through the center of the body of the heel bone there. A lot of times these are not easy to see on an x-ray. Most often you have to get an MRI or CAT scan to be able to visualize these injuries. Again, a period of immobilization is usually needed. Occasionally you also need to use a bone stimulating device to get the fracture to heal. Very rarely surgical intervention is needed. In that case, minimally invasive techniques are typically employed. The next one we want to talk about is the pinched nerve. There's a little nerve on the bottom of the heel. It's called Baxter's nerve. It runs right underneath the heel bone under here, right beneath the plantar fascia. And when you have thick plantar fascia or scar tissue in the area, it can put pressure on that little nerve called Baxter's nerve. Usually that presents as burning pain along the outside border of the foot, accompanied with the typical plantar fasciitis pain. Again, usually the conservative care will help this. A lot of times we would have to do a different type of injection other than the usual cortisone injection that we use. It's called a sclerosing alcohol injection, which is injected into the area of that irritated nerve, and that will shut down the pain fibers and stop it from firing. And now the last one I want to talk about is scar tissue formation. Occasionally, with long-standing plantar fascia conditions, scar tissue can form in the substance of the plantar fascia or where it's hooking onto the heel bone, and this could prevent the plantar fascia from healing completely. If this occurs, some type of intervention is needed to jumpstart the healing process and address that scar tissue. So there's a couple of non-invasive injection techniques that we use to jumpstart this. Also, shockwave treatment is another option to jumpstart the healing process. And if all else fails, then a surgical approach through minimally invasive means should be needed. So if anybody has any heel pain that's not responding to what you would typically apply, then these other issues could be a consideration. Good evaluation with some imaging studies can help arrive at the diagnosis and get you on the path to healthier feet. Any questions, you can contact us here in Danbury. We look forward to talking to you soon.